Welcome to The Explainer. Today we are diving into a true orthopedic emergency, compartment syndrome. And believe me, this is one of those conditions where every single minute counts, because a misdiagnosis can lead to absolutely catastrophic, irreversible damage.
So, let's start with a classic clinical scenario, something you'll definitely see. You've got a patient with a pretty straightforward fracture, but their pain, it's just escalating. They keep asking for more and more pain meds. Now, your first thought might be, are we just not managing their pain well? But this could be the very first and most critical clue that you're dealing with a limb-threatening emergency.
To really grasp the urgency here, we need to get into the core problem, the pathophysiology. It all boils down to a simple but absolutely brutal equation. It's all about pressure versus perfusion.
At its heart, compartment syndrome is basically a pressure cooker situation. You've got this closed, unyielding space, that's your osteofascial compartment, and for some reason, the pressure inside is just building and building and building. As that pressure climbs, it starts to squeeze the blood vessels, literally choking off the vital blood supply to the muscles and nerves trapped inside.
And here it is. This is the critical number you have to burn into your brain. Once the pressure inside that compartment gets above about 30 millimeters of mercury, it's now higher than the pressure that's trying to push blood into the tissues. So blood just can't get in effectively. Tissue ischemia begins, and the clock is officially, and very loudly, ticking.
Okay, so what kicks this whole dangerous process off? And more importantly, how fast does that ticking clock lead to permanent, irreversible damage? Let's take a look.
It really comes down to two main things. Most of the time, you've got something increasing the volume inside the compartment. Think about bleeding from a fracture. That's the cause in a staggering 70% of cases. Or just massive swelling from a bad muscle contusion. Less often the problem is that the compartment itself has been made smaller, maybe from a cast that's on way too tight or a surgical closure that's cinched down too hard. The real urgency of this condition becomes crystal clear when you look at this timeline. The tissues inside that compartment are incredibly sensitive to being starved of oxygen. Nerve tissue, it suffers irreversible damage after only about 2 hours. Muscles are a little tougher, they can last about 6 hours. By the time you get to 8 or 12 hours, even the skin is dying. This is not a wait-and-see situation. You have to act.
So, we know what's happening on the inside. Now, how does that translate to what we see in the patient? Recognizing compartment syndrome is all about spotting the subtle clues before the really obvious, and by then irreversible signs show up.
Here it is. This is your number one can't-miss-it red flag. The pain is completely out of proportion to what you'd expect from the injury. It's this deep, constant burning pain. So when your patient with a fracture says the pain is getting worse, even though they're immobilized and getting meds, you have to suspect compartment syndrome until you can prove it's not.
Now, what's a key finding? The single most sensitive clinical test you can do right at the bedside? It's pain on passive muscle stretch. That means you gently stretch the muscles in that compartment, and if they have compartment syndrome, it will cause excruciating pain. That sign, along with early nerve symptoms like paresthesia, that pins and needles feeling, or hypoxia, numbness, those are your crucial early clues.
And here is a massive, massive pitfall. Please do not be falsely reassured if you can feel a distal pulse or see good capillary refill. The pressure inside the compartment can be high enough to kill off all the tiny blood vessels long before it's high enough to shut down a major artery. If you wait until the pulse disappears, you have waited far, far too long.
While your clinical suspicion is absolutely key, the definitive, gold standard way to diagnose this is to just measure the pressure directly. You actually stick a needle or a catheter that's hooked up to a pressure monitor right into the compartment. It gives you an objective number, takes out the guesswork, and confirms your diagnosis. Okay, so given how fast this thing moves and how devastating the consequences are, the treatment has to be just as swift and decisive. And for established compartment syndrome, there's really only one effective treatment. The surgical game plan follows a very strict logical order. First, and most important, is decompression. That means an immediate fasciotomy. You make a long incision through the skin and, crucially, through the fascia underneath to just release all that pressure. Only after you've opened up all the affected compartments do you move on to stabilizing the fracture. And finally, and this is key, you never close the wound right away. The swelling is just too intense. Closing it would risk the pressure just shooting right back up.
All right, now let's talk about what happens if this is all missed, or if it's treated too late. This is the end-stage result, and it is a permanent catastrophe for the patient's limb and life.
This is Volkmann's ischemic contracture. It's the direct result of delay. The muscles and nerves in the compartment have literally died from lack of oxygen. The body's response is to replace all that dead tissue with fibrotic scar tissue. And what does scar tissue do? It shrinks and contracts over time, pulling the hand or foot into this fixed, rigid, claw-like deformity. The limb is useless. The loss of function is just catastrophic.
So we'll end with this thought, something to take with you. The next time you have a patient whose pain seems totally out of proportion, I want you to remember that timeline of irreversible damage. Before you even think about ordering an X-ray or even checking for a pulse, what's the single most sensitive clinical test you can do right there at the bedside? It's that gentle, passive stretch of the muscles. It can make all the difference in the world.